Hi, I'm Dr. Roger Clifford, your Dallas chiropractor. How do you know that you have found the right chiropractor? If you have back or neck pain, you've probably considered going to a chiropractor, and if you've already chosen a chiropractor, how do you know that you have found the right one? How do you know if you didn't? So I will be describing some tips and some do's and don'ts. And on the other hand, though, I don't want this video to be misconstrued as saying anything negative about any of my colleagues. That this is just designed to help you make sure that hopefully you've made the wise decision. So how do you feel like you trust your chiropractor? Do you feel like the recommendations that you're making? Do you feel like the recommendations are just strictly in what's in your best interest? I think that any doctor-patient relationship really, just like most relationships out there, otherwise, really comes down to trust. Do you have that intuition that you do feel like you trust your chiropractor, that you feel like you are in the right place? How does office look? Does the office look clean, and is it tidy? Does it look modern and professional? I know you perhaps can't tell a book by its cover, but I think that a lot can be said by how an office looks. If the office looks dirty and untidy, does it look like it's not being kept up to date? Then maybe there's some other problems underneath the surface that could even have some health consequences. So I do think that at least in the case of doctors and chiropractic offices, I think actually looks can be important. How about the staff? What's the staff like? I think that the staff of any chiropractic office, just like doctors' offices, they are a reflection of the chiropractors and doctors. So, do the staff, do they look professional and nice and clean? Do they look does it seem like they are helpful and courteous and pleasant? Or maybe the opposite is true, and if that is the case, then maybe that is a reflection of the chiropractor. So I think that you can tell some things about what we call the CAs, or chiropractic assistants, in a chiropractic office. Now, getting to what the chiropractor does or what the chiropractor doesn't do, the history. When you sat down with the chiropractor at first, did the chiropractor take a thorough and unrushed history, asking you different kinds of questions like how you're feeling and where the pain came from, what caused it, if it was a car accident, different specific details of the car accident, or even if it's not trauma related, maybe just going into asking you some questions about what kinds of things made it feel worse, or what things seem to make it feel better. Basically, there's a lot of different questions that chiropractors, like other doctors, are supposed to ask, even things that are unrelated. For instance, do you have any other health concerns? Have you ever had any major medical conditions? Sure, it may be in the initial paperwork that you filled out probably before you came into the chiropractic office, but still, though, it is, I think, good practice for the chiropractor to take his time and or her time to learn about you and allow you to to ask questions too. You should be able to feel like you have time and that you are in the right place to be able to have your questions answered. How about the examination? Was the examination thorough? Was it unrushed, or perhaps was it just done in 30 seconds and laying down on a table and feeling a couple of spots and saying, you need chiropractic? Well, I think that chiropractic examinations are supposed to be more thorough than that. We check reflexes, we do muscle testing, we do various orthopedic kinds of testing, at least we're supposed to. So, I think it is actually a red flag if you have gone to a chiropractor on a new patient visit, if no actual thorough or objective examinations were done. Then I think that is actually a big concern, or even a warning sign. Now, when it came to explaining the results of the history and examination, was that unrushed too? And did you feel like the chiropractor, just in a straightforward, objective manner, explained what was wrong and what can be done to help you? Or did you get a sense, and I know this gets back to trust, did you get a sense that perhaps things were being explained in a way where maybe there was an ulterior motive, that maybe it wasn't exactly in your best interest, but maybe it was designed to either use scare tactics or to try to tell you needed services that you don't feel like you really need or want. And I don't mean this as a negative of any chiropractors out there, but I just want to mention this to you for basically for your best interest. Now, was the recommendations for treatment, did you feel like you could go in for a short period of time? Do you feel like you could try chiropractic out in that office for just a small handful of visits, 1, 2, 3 visits, or a few visits over a couple of weeks, or were you told that you really needed several months of care, or even longer, many times a week for a long time? There are chiropractic techniques that are more involved in longer term treatment approaches, and they do have a merit, and this is no specific judgment on any specific chiropractic techniques. A lot of chiropractors in a long-term treatment model do really good work, but if you are looking for short-term to try to get out of pain as quickly as possible, do you feel like you could do that? I do believe that going to a chiropractor where you feel like you could do that, I think that is okay. If you are at an office where you are told you need extensive treatment, do you feel like you are being pushed into having to prepay for all of those treatments, many thousands of dollars prepayment? I mean, I don't really have any I guess politically correct way of saying this, and just in my opinion, if that is the case, I would really just simply not do that. I would not really recommend any prepayment of a long-term treatment plan. I think that if that is the case, if it's not too late, I would just not do that, or try to get out of that actually. Now, when it comes to the actual treatments, chiropractic treatments, are designed to get you better, of course. Sometimes people can feel a little bit worse or feel more sore later, and that's understandable, just like a new exercise program. Physical therapy is the same way. But chiropractic treatments shouldn't be very painful. I mean, it should feel pretty good. I really try to help my patients feel actually like the treatments that they get, they can look forward to getting, because they actually feel pretty good. I'm not saying 100% of the time that is the case, but still it shouldn't be causing sharp pain or severe pain. So if you go to a chiropractor, hopefully the treatments feel like they're getting the job done, but nothing crazy aggressive, and hopefully you can look forward to the treatments that you're getting as you're getting better. Do you feel like you're going to a chiropractor and the chiropractor is regularly seeing how you're doing? They're doing periodic checkups, re-examinations to make sure that your treatments are actually helping you. I think that's important. I do think that it's better to go to see somebody who is making sure that what they're doing is working in over limited increments of time, not several months or years, and then seeing, okay, well, let's see how you're doing now. I think that really within a few sessions or so, you should be able to have a re-examination and to be able to tell, okay, how are the treatments working, or maybe some kind of modifications need to be done. And so basically, just to reiterate, the trust is so important. I think it's listening to your intuition. The chiropractic profession, like any healthcare profession, there's good ones and there's not so good ones. So I hope that you can use this video to hopefully make sure that you are going to the right chiropractor, or even getting a second opinion from another chiropractor if you feel like that is needed. And so once again, this is your Dallas chiropractor, and I hope you have a great, healthy day.